Understanding bedroom requests. Why your husband wants you to try new things. Written and copyright by A. Castor. Chapter 3: Media Influence on Sexual Expectations. Introduction. In today's digitally connected world, media plays a significant role in shaping our perceptions and expectations about various aspects of life, including sexuality. This chapter delves into how media, particularly pornography and other sexually explicit content, influences sexual norms and expectations. By examining the distinction between fantasy and reality, and learning how to manage expectations influenced by external sources, readers can develop a healthier, more realistic understanding of sexual relationships. The impact of pornography and media on sexual norms. Pornography and mainstream media have a profound influence on societal attitudes towards sex. They often depict exaggerated or unrealistic sexual scenarios that can distort viewers' perceptions of what is normal or desirable in real-life sexual relationships. Shaping perceptions. Idealized bodies and behaviors. Media often portrays idealized physical appearances and sexual prowess that are unattainable for most people. This can lead to body image issues and unrealistic expectations about sexual performance. Scripts and stereotypes. Pornographic content frequently follows certain scripts and stereotypes, such as the notion that certain acts are universally pleasurable or that consent is always implicitly given. These stereotypes can misinform viewers about healthy sexual dynamics. Frequency and variety. Media may suggest that frequent and varied sexual activities are the norm, which can pressure individuals to conform to these perceived standards even if they do not align with their personal desires or comfort levels. Impact on relationships. Performance pressure. Exposure to media's portrayal of sex can create pressure to perform in specific ways, potentially leading to anxiety and decreased sexual satisfaction. Desensitization. Regular consumption of explicit content can lead to desensitization, where individuals require more extreme stimuli to achieve the same level of arousal. Comparative dissatisfaction. Comparing one's sex life to media portrayals can result in dissatisfaction and unrealistic expectations, undermining relationship intimacy. Differentiating between fantasy and reality. Understanding the distinction between fantasy, as depicted in media, and the realities of sexual relationships is crucial for maintaining a healthy perspective on sex. Nature of fantasy. Purpose of fantasy. Fantasies serve as a creative and imaginative outlet for exploring desires and scenarios that may not be feasible or desirable in real life. Safety and control. Fantasies allow for the exploration of taboos and extreme scenarios in a controlled, safe environment without real-world consequences. Media versus real-life dynamics. Staged performances. Pornographic content is often scripted, edited, and staged to enhance entertainment value, unlike the spontaneous nature of real-life sexual encounters. Lack of context. Media rarely provides context, such as the emotional connection, communication, and consent that are fundamental to real-life sexual relationships. Physical realities. Real-life sex involves diverse body types, imperfections, and limitations that are often airbrushed or edited out of media portrayals. Balancing fantasy and reality. Open discussion. Couples should openly discuss their fantasies and understand that not all fantasies are meant to be acted upon. Mutual consent. Any attempt to integrate fantasies into real life should be done with mutual consent and respect for boundaries. Grounded expectations. Keeping expectations grounded in reality helps maintain a healthy, satisfying sexual relationship. Managing expectations influenced by external sources. Managing expectations influenced by media requires critical thinking, self-awareness, and effective communication. Critical consumption of media. Media literacy. Develop skills to critically analyze media content, understanding its intent, context, and potential impact. Selective viewing. Choose media that aligns with personal values and promotes healthy, realistic portrayals of sexuality. Self-awareness and reflection. Personal values. Reflect on personal values and beliefs about sex, separate from media influences. Body positivity. Cultivate a positive body image and self-acceptance, recognizing that media representations are often unrealistic. Effective communication. Discuss influences. Openly discuss with your partner how media influences your sexual expectations and address any discrepancies between fantasy and reality. Recalibrate expectations. Work together to recalibrate expectations, focusing on mutual satisfaction and realistic experiences. Seek guidance. Consider seeking guidance from a therapist or counselor if media influences are significantly impacting your relationship. Conclusion. Understanding the impact of media on sexual expectations is crucial for maintaining a healthy, realistic perspective on sex. By differentiating between fantasy and reality and managing expectations influenced by external sources, individuals and couples can foster more satisfying and authentic sexual relationships. This chapter provides the tools to navigate the complex landscape of media influence, promoting a balanced and informed approach to sexuality. Shaping perceptions, idealized bodies, and behaviors. Introduction. Media plays a significant role in shaping perceptions of sexuality and physical appearance. The portrayal of idealized bodies and behaviors in various media forms can create unrealistic expectations and impact individuals' self-esteem and sexual relationships. This chapter delves into how these idealized images affect body image and sexual performance expectations, and offers insights into mitigating their negative effects. Shaping perceptions, idealized bodies and behaviors. Idealized bodies. Media portrayals. Television, movies, advertisements, and social media often showcase bodies that adhere to narrow standards of beauty, emphasizing slimness, muscularity, and youth. Unattainable standards. These portrayals often involve significant digital alteration and selective casting, creating an unattainable standard of beauty. Impact on self-esteem. Constant exposure to these idealized images can lead to body dissatisfaction, as individuals compare themselves to unrealistic standards. Body image issues. The pressure to conform to media ideals can result in various body image issues. Negative self-perception. People may develop a negative self-perception, feeling inadequate or unattractive because they do not match the media's portrayal of beauty. Eating disorders and dysmorphia. In extreme cases, this dissatisfaction can lead to eating disorders, body dysmorphic disorder, and other mental health issues. Idealized behaviors. Sexual prowess. Media often depicts sexual encounters as always passionate, adventurous, and flawless, creating unrealistic expectations about sexual performance. Performance pressure. This portrayal can lead to performance anxiety, as individuals feel pressured to meet these idealized standards in their own sexual experiences. Misrepresentation of reality. Real sexual relationships often involve awkward moments, varying desires, and imperfections, which are rarely depicted in media. Behavioral expectations. Media can influence expectations about what is considered normal or desirable sexual behavior. Experimentation and risk. Portraying risky or extreme sexual behaviors as the norm can pressure individuals to engage in activities they may not be comfortable with. Misalignment with personal values. These portrayals can conflict with an individual's personal or cultural values, causing internal conflict and stress. Mitigating negative effects. Media literacy. Developing media literacy skills can help individuals critically analyze and question the unrealistic portrayals they encounter. Critical thinking. Encourage critical thinking about the sources and motivations behind media images, recognizing the use of digital alteration and selective representation. Realistic comparisons. Promote comparisons with real, diverse bodies and behaviors rather than idealized media portrayals. Positive role models. Seek out and promote positive role models and media representations that showcase diverse body types and realistic sexual behaviors. Inclusive media. Support and consume media that includes diverse and inclusive representations of beauty and sexuality. Empowerment and acceptance. Encourage self-acceptance and empowerment by highlighting the value of personal uniqueness and individuality. Conclusion. The pervasive influence of media on perceptions of idealized bodies and behaviors can lead to unrealistic expectations and body image issues. By fostering media literacy, promoting positive role models, and encouraging self-acceptance, individuals can mitigate the negative effects of these portrayals. Understanding and addressing the impact of media on sexual perceptions is crucial for developing a healthier and more realistic approach to body image and sexual relationships. Shaping perceptions, scripts, and stereotypes. Introduction: pornographic content is a pervasive influence on sexual perceptions, often depicting unrealistic and harmful scripts and stereotypes. These portrayals can shape viewers' understanding of sexual dynamics, leading to misconceptions about what constitutes healthy and consensual sexual relationships. This chapter explores the impact of these scripts and stereotypes and offers guidance on how to cultivate a more informed and realistic perspective on sexuality. Shaping perceptions, scripts, and stereotypes. Scripts in pornography. Common scripts. Pornography often follows certain scripts that portray sex as always spontaneous, passionate, and devoid of emotional connection. Universally pleasurable acts. These scripts suggest that specific acts, such as certain positions or practices, are universally pleasurable and desired by all individuals. Simplified dynamics. The complexity of real-life sexual dynamics, including emotional connection and communication, is often oversimplified or ignored. Impact on expectations. These scripts can create unrealistic expectations about sexual encounters. Performance pressure. Viewers may feel pressured to mimic these scripted behaviors, believing they are standard or expected. Disappointment and dissatisfaction. When real-life experiences do not match these scripted portrayals, it can lead to feelings of inadequacy and dissatisfaction. Stereotypes in pornography. Gender roles. Pornographic content frequently reinforces traditional gender roles, with men depicted as dominant and women as submissive or objectified. Misrepresentation of consent. Consent is often implied rather than explicitly given, reinforcing the harmful notion that verbal consent is unnecessary. Harmful stereotypes. These portrayals perpetuate stereotypes about sexual behavior, such as the idea that men are always ready for sex and that women should be passive recipients. Diverse experiences. Real sexual experiences are diverse and multifaceted, encompassing a wide range of preferences, dynamics, and consent practices. Underrepresentation. Many pornographic portrayals do not accurately represent the diversity of sexual identities, orientations, and preferences, leading to a narrow understanding of sexuality. Misinforming viewers. Unhealthy dynamics. Viewers may internalize these scripts and stereotypes, leading to unhealthy sexual dynamics in their own relationships. Communication gaps. The lack of emphasis on communication and consent in pornography can result in viewers neglecting these crucial aspects in their sexual relationships. Misguided beliefs. Viewers may develop misguided beliefs about what is normal or acceptable in sexual interactions, potentially causing harm to themselves or their partners. Addressing misconceptions. It is essential to address and correct these misconceptions to promote healthy and respectful sexual relationships. Education and awareness. Providing accurate information about sexual health, consent, and communication can help counteract the misleading portrayals in pornography. Open dialogue. Encouraging open dialogue about sexuality and the impact of pornography can foster a more informed and respectful approach to sexual relationships. Conclusion. Pornographic scripts and stereotypes can significantly shape perceptions of sexual dynamics, often leading to unrealistic and harmful beliefs about sexuality. By recognizing and addressing these misconceptions, individuals can cultivate a healthier and more realistic understanding of sexual relationships. Education, open dialogue, and a critical approach to media consumption are key to mitigating the negative impact of these portrayals and promoting healthy sexual dynamics. Shaping perceptions, frequency, and variety. Introduction media, including movies, television, and pornography, often portrays sexual relationships in a way that suggests frequent and varied sexual activities are the norm. These portrayals can create pressure for individuals to conform to these perceived standards, even if they do not align with their personal desires or comfort levels. This chapter explores the impact of these media-driven perceptions and offers strategies for developing a healthier, more individualized approach to sexual frequency and variety. Shaping perceptions, frequency and variety. Media portrayals of sexual frequency. High-frequency depictions. Media often depicts couples engaging in sexual activities with high frequency, suggesting that daily or even multiple daily encounters are typical. Unrealistic standards. These portrayals create unrealistic standards that can lead individuals to feel inadequate if their own experiences do not match these depictions. Pressure to perform. The pressure to meet these high-frequency expectations can result in stress, anxiety, and strain on the relationship. Impact on self-esteem. Feeling that one's sexual life is insufficient compared to media portrayals can negatively impact self-esteem and relationship satisfaction. Comparisons. Constant comparison to media standards can foster feelings of inadequacy and dissatisfaction, even if one's sexual relationship is healthy and fulfilling by more realistic standards. Media portrayals of sexual variety. Diverse activities. Media frequently showcases a wide variety of sexual activities, positions, and settings, implying that constant novelty is necessary for a satisfying sexual relationship. Expectations of novelty. This can create the expectation that partners should continuously seek new and adventurous sexual experiences to maintain interest and satisfaction. Risk of discomfort. Trying to meet these expectations can lead individuals to engage in activities they are not comfortable with, potentially harming their well-being and relationship. Misalignment with personal desires. Not everyone has the same level of desire for variety in their sexual activities, and media portrayals can make those with more conservative or consistent preferences feel abnormal or inadequate. Pressure to conform. Conforming to standards. The perceived need to conform to media-driven standards of frequency and variety can overshadow personal desires and comfort levels. Loss of authenticity. Individuals may prioritize meeting these external standards over authentic sexual expression and mutual satisfaction. Relationship strain. The pressure to conform can lead to frustration, resentment, and conflict within relationships. Negative impacts on consent. Feeling pressured to conform can undermine the importance of mutual consent, as individuals may agree to activities they are uncomfortable with to meet perceived standards. Respecting boundaries. It is crucial to prioritize mutual respect and communication over conforming to external pressures. Developing a healthier approach. Personal desires. Emphasize the importance of tuning into personal desires and comfort levels rather than adhering to media portrayals. Individual differences. Recognize that sexual frequency and variety preferences vary greatly among individuals and couples, and there is no one-size-fits-all standard. Healthy communication. Open communication about desires, boundaries, and comfort levels is key to a satisfying and consensual sexual relationship. Reframing expectations. Reframe expectations by understanding that media portrayals are often exaggerated and do not reflect the diversity of real-life sexual experiences. Realistic standards. Encourage the development of realistic standards that are tailored to the unique dynamics of each relationship. Focusing on quality. Prioritize the quality of sexual encounters over the quantity or variety, ensuring that each experience is mutually satisfying and consensual. Conclusion. Media portrayals of sexual frequency and variety can create unrealistic expectations and pressure individuals to conform to standards that may not align with their personal desires or comfort levels. By developing a healthier approach that prioritizes individual preferences, mutual consent, and open communication, couples can foster a more satisfying and authentic sexual relationship. Understanding and addressing the impact of media on perceptions of sexuality is essential for maintaining a healthy and fulfilling sexual connection. Impact on relationships, performance pressure. Introduction. The pervasive influence of media on perceptions of sex can create unrealistic expectations and pressures that significantly impact intimate relationships. Media portrayals often set unattainable standards for sexual performance, which can lead to anxiety, decreased sexual satisfaction, and strain within relationships. This chapter delves into the ways media-induced performance pressure affects relationships and offers strategies for managing and mitigating these impacts. Impact on relationships, performance pressure. Media's portrayal of sexual performance. Idealized scenarios. Media often depicts sexual encounters as flawless, highly pleasurable, and effortlessly executed. Perfectionism. These portrayals create an idealized version of sex that is often unrealistic and unattainable for most people. Impressionable audiences. Young or impressionable viewers may internalize these standards, believing them to be the norm. Unrealistic expectations. The portrayal of perfect sexual performance sets high expectations that can be difficult to meet in real-life situations. Physical attributes. Media often emphasizes specific physical attributes and prowess, further contributing to unrealistic standards. Performance pressure and its effects. Anxiety and stress. The pressure to meet these idealized standards can lead to significant anxiety and stress about sexual performance. Performance anxiety. Concerns about measuring up to media portrayals can result in performance anxiety, which can negatively affect sexual function and enjoyment. Fear of judgment. Individuals may fear judgment or rejection if they feel they do not meet the expected standards. Decreased sexual satisfaction. The focus on performance can detract from the enjoyment of the experience, leading to decreased sexual satisfaction for both partners. Loss of spontaneity. Overemphasis on performance can reduce spontaneity and the natural flow of intimacy, making encounters feel more like a performance than a genuine connection. Emotional disconnect. The pressure to perform can create an emotional disconnect, as individuals may prioritize physical acts over emotional intimacy. Strain on relationships. Increased tension. The anxiety and stress caused by performance pressure can lead to increased tension and conflict within relationships. Miscommunication. Partners may misinterpret each other's actions or concerns, leading to misunderstandings and arguments. Resentment. Ongoing performance pressure can result in feelings of resentment, especially if one partner feels consistently inadequate or criticized. Erosion of intimacy. The focus on performance can erode emotional and physical intimacy, as partners may become more concerned with meeting expectations than connecting with each other. Avoidance of intimacy. Some individuals may begin to avoid sexual encounters altogether to escape the pressure and associated anxiety. Reduced emotional connection. Over time, the emphasis on performance can weaken the emotional bond between partners, making it harder to maintain a healthy and satisfying relationship. Managing and mitigating performance pressure. Open communication. Discussing concerns and expectations openly with a partner can alleviate performance pressure and foster a more supportive environment. Expressing feelings. Encouraging partners to express their feelings and insecurities can help in understanding and addressing the root causes of performance anxiety. Mutual support. Providing mutual support and reassurance can strengthen the emotional connection and reduce pressure. Realistic expectations. Reframing expectations by understanding that media portrayals are often exaggerated and do not reflect typical real-life experiences. Focus on connection. Shifting the focus from performance to connection and pleasure can enhance the overall sexual experience. Mindfulness practices. Incorporating mindfulness practices can help individuals stay present in the moment and reduce anxiety. Seeking professional help. Therapy or counseling can be beneficial for individuals or couples struggling with performance pressure and its impacts. Sex therapy. Sex therapists can provide strategies and techniques for managing performance anxiety and improving sexual satisfaction. Couples counseling. Couples counseling can address communication issues and help partners navigate the challenges related to performance pressure. Conclusion. Performance pressure driven by media portrayals of sex can create significant challenges in intimate relationships. By fostering open communication, setting realistic expectations, and seeking professional help when needed, individuals and couples can mitigate the negative impacts of performance pressure. Prioritizing emotional connection and mutual satisfaction over media-driven standards can lead to a healthier and more fulfilling sexual relationship. Impact on relationships. Desensitization. Introduction. Desensitization refers to the process by which repeated exposure to certain stimuli reduces their emotional impact over time. In the context of sexual relationships, desensitization can occur due to regular consumption of explicit content, leading individuals to seek increasingly extreme or varied stimuli to achieve the same level of arousal. This phenomenon can significantly impact intimate relationships, affecting sexual satisfaction, intimacy, and emotional connection. This chapter explores how desensitization affects relationships and offers strategies for managing its impacts. Impact on relationships. Desensitization. Understanding desensitization. Definition and mechanism. Desensitization occurs when repeated exposure to a particular stimulus decreases its emotional and physiological impact. Tolerance development. Similar to how one might develop a tolerance to a drug, individuals can develop a tolerance to explicit content, requiring more intense stimuli to achieve the same arousal. Neurobiological factors. Repeated exposure to explicit content can alter brain chemistry, affecting dopamine receptors and reducing sensitivity to sexual stimuli. Effects on arousal and sexual desire. Increased threshold for arousal. Regular consumption of explicit content can raise the threshold for sexual arousal, making it more difficult to become aroused by typical or real-life sexual encounters. Seeking extreme stimuli. Individuals may start seeking more extreme or novel stimuli to achieve the desired level of arousal. Reduced interest in partner. Real-life sexual experiences with a partner may seem less exciting or stimulating compared to the explicit content consumed. Impact on sexual desire. Desensitization can lead to a decreased interest in sex with a partner, as the usual stimuli may no longer be sufficient to trigger arousal. Decreased libido. Over time, the inability to achieve arousal can lead to a decreased overall interest in sex, affecting libido. Disconnection from partner. The focus on explicit content can create a disconnect from the partner, reducing sexual and emotional intimacy. Impact on relationship dynamics. Strain on sexual relationship. The need for more extreme stimuli can create tension and dissatisfaction in the sexual relationship. Mismatch in desires. One partner may feel pressured to engage in activities they are uncomfortable with to meet the other's increased threshold for arousal. Feelings of inadequacy. The partner not requiring extreme stimuli may feel inadequate or rejected, leading to emotional distress and conflict. Emotional disconnection. Desensitization can lead to an emotional disconnection, as the focus shifts from shared experiences to individual gratification through explicit content. Reduced emotional intimacy. The emotional bond can weaken as sexual interactions become less fulfilling and more mechanical. Isolation and loneliness. Both partners may feel isolated and lonely, struggling to reconnect on an emotional and physical level. Managing and mitigating desensitization. Open communication. Discussing the issue of desensitization openly with a partner can help address concerns and find mutually satisfying solutions. Sharing feelings. Both partners should feel comfortable sharing their feelings and experiences related to desensitization. Non-judgmental approach. A non-judgmental approach can foster a supportive environment for discussing sensitive topics. Exploring new experiences together. Finding new ways to explore intimacy together can help reestablish excitement and connection. Mutual exploration. Partners can explore new sexual activities or fantasies together, ensuring that both feel comfortable and enthusiastic. Quality time. Spending quality time together outside of sexual activities can strengthen the emotional bond and enhance overall intimacy. Limiting exposure to explicit content. Reducing or eliminating the consumption of explicit content can help reset arousal thresholds. Digital detox. Taking a break from explicit content can allow the brain to readjust and become more responsive to real-life stimuli. Focus on real-life connection. Prioritizing real-life sexual and emotional connections over digital stimuli can help rebuild intimacy. Seeking professional help, therapy or counseling can provide support and strategies for managing desensitization and its effects on the relationship. Sex therapy. A sex therapist can help individuals and couples address issues related to desensitization and improve sexual satisfaction. Couples counseling. Counseling can facilitate open communication, rebuild trust, and strengthen the emotional connection between partners. Conclusion. Desensitization from regular consumption of explicit content can have profound effects on intimate relationships, leading to increased arousal thresholds, decreased sexual desire, and emotional disconnection. By fostering open communication, exploring new experiences together, and seeking professional help when needed, couples can manage and mitigate the impacts of desensitization. Prioritizing real-life connections and intimacy over digital stimuli can help maintain a healthy and satisfying sexual relationship. Impact on relationships, comparative dissatisfaction. Introduction in the digital age, media portrayals of sex are pervasive and often idealized, showcasing perfect bodies, endless passion, and flawless performances. These depictions, while fictional, can create unrealistic expectations about sex and intimacy. When individuals compare their own sex lives to these media portrayals, it can lead to feelings of dissatisfaction, inadequacy, and frustration. This chapter explores how comparative dissatisfaction affects relationships and offers strategies to manage these impacts. Impact on relationships, comparative dissatisfaction. Understanding comparative dissatisfaction. Definition and mechanism. Comparative dissatisfaction occurs when individuals assess their own experiences against idealized standards set by media. Idealized media portrayals media, including movies, TV shows, and pornography, often present sex in an idealized manner, focusing on physical perfection and flawless execution. Unrealistic standards. These portrayals create unrealistic standards for what sex should look like, feel like, and be like, setting up impossible benchmarks for real-life experiences. Effects on individual perception. Body image issues. Comparing oneself to the often unattainable physical ideals in media can lead to body image issues and self-esteem problems. Self-consciousness. Individuals may become self-conscious about their bodies, feeling inadequate or unattractive. Sexual inhibition. This self-consciousness can inhibit sexual desire and performance, as individuals may feel too insecure to fully engage in sexual activities. Performance anxiety. The pressure to perform sexually in ways depicted in media can lead to anxiety and stress. Fear of judgment. Individuals might fear being judged by their partners for not living up to media portrayals, leading to performance anxiety. Reduced enjoyment. Anxiety and stress can reduce overall enjoyment of sexual activities, further contributing to dissatisfaction. Effects on relationship dynamics. Erosion of intimacy. Unrealistic comparisons can erode intimacy and trust in a relationship. Emotional distance. Partners may feel emotionally distant if one or both are preoccupied with unrealistic expectations. Decreased connection. The emotional connection can weaken as partners focus more on perceived inadequacies than on genuine connection. Conflict and resentment. Dissatisfaction stemming from comparisons can lead to conflict and resentment between partners. Blame and frustration. Partners may blame each other for not meeting unrealistic standards, leading to frustration and arguments. Communication breakdown. Negative feelings can hinder open communication, making it difficult to address and resolve issues. Strategies to manage comparative dissatisfaction. Promoting realistic expectations. Reframing expectations to be more aligned with reality can help mitigate comparative dissatisfaction. Media literacy. Understanding that media portrayals are often exaggerated or unrealistic can help individuals set more realistic expectations. Focus on personal experience. Emphasizing personal and partner satisfaction over external comparisons can enhance sexual fulfillment. Enhancing body positivity. Cultivating a positive body image can reduce the negative impact of media comparisons. Self-acceptance. Practicing self-acceptance and appreciating one's body can improve self-esteem and sexual confidence. Mutual affirmation. Partners can support each other by offering affirmations and compliments, fostering a positive sexual environment. Reducing media consumption. Limiting exposure to explicit or idealized sexual content can help reduce comparative dissatisfaction. Digital detox. Taking breaks from media consumption can help individuals reset their expectations and focus on real-life connections. Mindful consumption. Being mindful of the type of media consumed and its impact on perceptions can help manage unrealistic expectations. Strengthening emotional connection. Focusing on emotional intimacy can enhance sexual satisfaction and reduce the emphasis on physical perfection. Quality time. Spending quality time together, engaging in non-sexual activities, can strengthen the emotional bond. Open communication. Maintaining open and honest communication about desires, insecurities, and expectations can help partners understand and support each other. Seeking professional help, therapy, or counseling can provide support for individuals and couples struggling with comparative dissatisfaction. Sex therapy. A sex therapist can help address issues related to performance anxiety, body image, and unrealistic expectations. Couples counseling. Counseling can facilitate discussions about dissatisfaction and help partners develop healthier, more realistic perspectives on their sexual relationship. Conclusion. Comparative dissatisfaction resulting from unrealistic media portrayals of sex can significantly impact relationships, leading to feelings of inadequacy, performance anxiety, and erosion of intimacy. By promoting realistic expectations, enhancing body positivity, reducing media consumption, and strengthening emotional connections, couples can manage and mitigate the negative impacts of comparative dissatisfaction. Open communication and professional support can further help individuals and couples navigate these challenges, fostering healthier and more satisfying sexual relationships. Understanding fantasies. Nature of fantasy. Introduction. Sexual fantasies are a natural and common aspect of human sexuality, providing an imaginative space where desires, scenarios, and experiences can be explored without the constraints of reality. This chapter delves into the nature of sexual fantasies, examining their purpose and the safety and control they offer. By understanding the role of fantasies in sexual life, individuals and couples can appreciate their significance and integrate them into their relationships in a healthy and enriching manner. Nature of fantasy. Purpose of fantasy. Creative and imaginative outlet. Fantasies provide a mental space for creativity and imagination, allowing individuals to explore desires and scenarios that may not be feasible or desirable in real life. Exploring desires. Fantasies enable individuals to explore various desires, including those that might be impractical or impossible to fulfill in reality. This can include scenarios that are physically impossible, socially unacceptable, or beyond personal comfort zones. Enhancing arousal. Fantasizing can enhance sexual arousal and excitement. The mental imagery and scenarios created in fantasies can stimulate the mind and body, intensifying the sexual experience. Emotional and psychological fulfillment. Fantasies can fulfill emotional and psychological needs by providing a sense of novelty, adventure, and excitement. Emotional satisfaction. Fantasies can fulfill emotional needs by allowing individuals to imagine scenarios that provide comfort, excitement, or a sense of adventure. This can be particularly important for those whose real-life circumstances might not offer such experiences. Psychological exploration. Engaging in fantasies allows individuals to explore different aspects of their identity and sexuality. This can include experimenting with different roles, power dynamics, or identities in a safe and controlled manner. Safety and control. Exploration of taboos. Fantasies allow individuals to explore taboos and extreme scenarios in a controlled, safe environment without real-world consequences. Testing boundaries. Fantasies provide a safe space to test the boundaries of one's desires and interests. This can include exploring scenarios that might be considered taboo or socially unacceptable. No real-world consequences. Unlike real-life actions, fantasies do not have real-world consequences. This allows individuals to safely explore their desires without the risk of harm, judgment, or legal repercussions. Sense of control. Fantasies offer a sense of control over the imagined scenario, allowing individuals to dictate every aspect of the experience. Complete autonomy. In fantasies, individuals have complete autonomy over the narrative, characters, and outcomes. This control can be empowering and satisfying, as it allows individuals to create perfect, tailored experiences. Managing anxiety and stress. Fantasies can serve as a coping mechanism for managing anxiety and stress. By creating a controlled, pleasurable mental escape, individuals can temporarily distance themselves from real-life pressures and concerns. Safe exploration of desires. Fantasies provide a risk-free way to explore desires that might be unsafe or impractical to pursue in real life. Risk-free environment. Fantasies eliminate the risks associated with certain real-life sexual activities. This can include physical danger, emotional harm, or social stigma. Imaginative freedom. Within the realm of fantasy, individuals are free to explore any scenario without fear of judgment or rejection. This freedom allows for a broader and more uninhibited exploration of one's sexual psyche. Conclusion: sexual fantasies play a crucial role in human sexuality by providing a creative and imaginative outlet for exploring desires and scenarios that may not be feasible or desirable in real life. They offer a safe and controlled environment for the exploration of taboos and extreme scenarios, allowing individuals to fulfill emotional and psychological needs, enhance arousal, and manage anxiety and stress. By understanding the nature and purpose of fantasies, individuals and couples can appreciate their significance and integrate them into their relationships in a healthy and enriching manner. This understanding fosters a deeper connection and intimacy, enhancing the overall sexual experience. Media versus real-life dynamics. Introduction: the portrayal of sex in media, particularly in pornography, can significantly influence perceptions and expectations of real-life sexual encounters. Understanding the differences between staged performances and genuine interactions is essential for maintaining realistic and healthy sexual relationships. This chapter explores the key contrasts between media representations and real-life dynamics, emphasizing the importance of context, emotional connection, and physical realities in authentic sexual experiences. Media versus real-life dynamics. Staged performances. Scripted content. Pornographic content is often carefully scripted and choreographed to maximize entertainment value and arousal. Predetermined scenarios. The scenarios depicted in pornography are predetermined and designed to cater to specific fantasies or fetishes, often ignoring the natural flow of sexual encounters. Professional actors. Performers are professional actors who are trained to simulate pleasure and execute intricate positions that might not be comfortable or feasible for the average person. Edited and enhanced. The final product is heavily edited to remove any imperfections, awkward moments, or pauses that naturally occur during sex. Multiple takes. Scenes are shot in multiple takes, allowing for the best angles and most visually appealing moments to be selected. Special effects. Lighting, sound effects, and sometimes even digital enhancements are used to create an idealized version of sex that is far removed from reality. Unrealistic endurance and performance. Actors often portray exaggerated levels of stamina and endurance that are not reflective of typical sexual experiences. Use of enhancements. Performers may use drugs or other enhancements to maintain erections and prolong performances beyond normal human capacity. Infrequent depiction of realistic sexual challenges. Issues like awkward positioning, discomfort, or the need for breaks are rarely shown, leading to unrealistic expectations. Lack of context. Missing emotional connection. Media often omits the emotional connection and intimacy that are fundamental to a healthy sexual relationship. Absence of relationship building. The deep bonds formed through shared experiences, mutual respect, and emotional support are rarely depicted in pornographic content. Superficial interactions. Interactions are typically portrayed as purely physical, ignoring the emotional and psychological components of real-life sex. Neglecting communication. Effective communication is crucial for understanding each other's needs and boundaries, but this aspect is often overlooked in media portrayals. Consent. Clear, enthusiastic consent is a cornerstone of healthy sexual encounters, but is frequently implied or completely omitted in media. Negotiation and feedback. Real-life sex often involves ongoing negotiation and feedback to ensure mutual satisfaction, which is not shown in scripted performances. Lack of consequences. Media does not depict the potential emotional or physical consequences of sexual activities. Emotional repercussions. The impact of sexual interactions on emotional well-being, such as feelings of regret or attachment, is rarely considered. Physical aftereffects. Real-life sexual activities can have physical aftereffects, such as fatigue or discomfort, which are typically edited out of media portrayals. Physical realities. Diverse body types. Real-life sex involves a wide range of body types, each with unique characteristics and imperfections. Airbrushing and editing. Media often presents airbrushed and digitally altered images that create unrealistic body standards. Variety of appearances. Real-life bodies have diverse shapes, sizes, and features that are rarely represented in media. Imperfections and limitations. Genuine sexual encounters include natural imperfections and limitations. Natural bodily functions. Real-life sex can involve natural bodily functions, such as sweating, noises, and unplanned reactions, which are usually excluded from media. Physical comfort. Positions and activities that are comfortable and pleasurable for actors may not be suitable for everyone, and real-life couples must navigate these physical limitations. Realistic expectations. Understanding and accepting the physical realities of one's own and their partner's bodies is crucial for healthy sexual relationships. Positive body image. Embracing one's own and one's partner's natural bodies can enhance intimacy and reduce pressure to conform to unrealistic standards. Comfort and safety. Prioritizing comfort and safety over mimicking media portrayals can lead to more fulfilling and pleasurable sexual experiences. Conclusion. The stark differences between media portrayals of sex and real-life dynamics can shape unrealistic expectations and pressures that may harm relationships. Recognizing that pornographic content is scripted, edited, and staged for entertainment helps in setting realistic and healthy standards for sexual interactions. By emphasizing the importance of emotional connection, effective communication, and understanding the physical realities of one's own and one's partner's bodies, individuals and couples can foster more satisfying and authentic sexual relationships. Balancing fantasy and reality. Introduction. Balancing fantasy and reality is an essential aspect of a healthy sexual relationship. Fantasies provide a creative and imaginative outlet, but integrating them into real life requires careful consideration and communication. This chapter explores how couples can navigate their fantasies, ensuring mutual consent and grounded expectations to maintain a satisfying and respectful sexual relationship. Balancing fantasy and reality. Open discussion. Creating a safe space. Couples should establish a safe and non-judgmental environment where they can freely discuss their sexual fantasies. Active listening. Encourage open dialogue by actively listening to each other's fantasies without immediate judgment or dismissal. Respectful communication. Approach the conversation with respect and sensitivity, acknowledging that sharing fantasies can be vulnerable and personal. Understanding fantasies. Recognize that fantasies are a normal part of sexual expression and do not necessarily reflect a desire to act on them. Exploring meanings. Discuss the underlying desires or emotions associated with the fantasies to better understand each other's needs and interests. Normalizing fantasies. Acknowledge that having fantasies is common and does not indicate dissatisfaction with the current sexual relationship. Distinguishing fantasy from reality. Clarify that not all fantasies are meant to be acted upon, and that some may remain purely within the realm of imagination. Setting boundaries. Identify which fantasies might be safe and feasible to explore together, and which ones are best left as private thoughts. Balancing privacy and sharing. Respect each other's comfort levels regarding the extent to which fantasies are shared or kept private. Mutual consent. Establishing consent. Any attempt to bring fantasies into real life must be done with explicit mutual consent. Clear communication. Ensure that both partners clearly communicate their willingness to explore specific fantasies. Ongoing consent. Consent should be an ongoing process, with the freedom to withdraw at any time if discomfort arises. Respecting boundaries. Both partners should respect each other's boundaries and comfort levels. Defining limits. Discuss and agree upon clear boundaries to prevent any feelings of pressure or coercion. Using safe words. Establish safe words or signals that can be used to pause or stop any activity if it becomes uncomfortable. Exploring together. If both partners are interested in exploring a fantasy, they should do so together with mutual respect and understanding. Gradual exploration. Start with less intense aspects of the fantasy and gradually explore further if both partners feel comfortable. Checking in. Regularly check in with each other to ensure that both partners are enjoying the experience and feel safe. Grounded expectations. Realistic perspectives. Keep expectations grounded in reality to avoid disappointment or dissatisfaction. Recognizing differences. Acknowledge that real-life sexual experiences may differ from the imagined scenarios in fantasies. Embracing imperfections. Accept that real-life sex involves natural imperfections and spontaneity that might not align with the idealized versions in fantasies. Managing disappointment. Be prepared for the possibility that bringing a fantasy to life might not always meet expectations. Open communication. Discuss any feelings of disappointment or discomfort openly and without blame. Adjusting approaches. Be willing to adjust the approach or discontinue the exploration if it does not enhance the sexual relationship. Fostering intimacy. Focus on the intimacy and connection that can be deepened through the shared experience of exploring fantasies. Building trust. Use the process of sharing and exploring fantasies to build trust and strengthen the emotional bond. Prioritizing pleasure. Ensure that the primary goal remains mutual pleasure and satisfaction, rather than perfect execution of the fantasy. Conclusion. Balancing fantasy and reality in a sexual relationship requires open discussion, mutual consent, and grounded expectations. By creating a safe space for sharing fantasies, respecting each other's boundaries, and keeping expectations realistic, couples can enhance their intimacy and sexual satisfaction. Integrating fantasies thoughtfully and respectfully can lead to a deeper connection and a more fulfilling sexual relationship. Critical consumption of media. Introduction. In today's digital age, media plays a significant role in shaping our perceptions and attitudes towards sexuality. Understanding how to critically consume media can help individuals navigate the often unrealistic portrayals of sex and relationships. This chapter focuses on developing media literacy and making selective viewing choices to promote healthier and more realistic sexual attitudes. Critical consumption of media. Media literacy. Understanding media content. Analyzing intent. Learn to identify the purpose behind media content. Is it meant to entertain, inform, or sell a product? Understanding the intent can help you critically evaluate its messages. Questioning motives. Ask yourself why a particular piece of content was created and what it aims to achieve. Recognize that many forms of media, especially pornography, are created primarily for entertainment and profit. Recognizing bias. Be aware that media often contains biases and may not present a balanced or accurate portrayal of reality. Contextual analysis. Consider the context in which media is produced and consumed. How do cultural, social, and economic factors influence the content and its reception? Historical context. Reflect on how historical and cultural contexts shape media narratives. Recognize that what is considered acceptable or desirable can vary widely across different times and cultures. Societal impact. Think about how media content reflects and influences societal norms and values. Understanding this interplay can provide deeper insights into the messages being conveyed. Evaluating impact. Assess how media content affects your thoughts, feelings, and behaviors. Does it reinforce stereotypes, create unrealistic expectations, or influence your self-image? Personal reflection. Reflect on your reactions to media content. Does it make you feel empowered, insecure, or pressured to conform to certain standards? Behavioral influence. Consider how exposure to certain types of media might affect your attitudes and behaviors, particularly in your relationships and sexual life. Selective viewing. Choosing media wisely. Aligning with personal values. Select media content that aligns with your values and promotes healthy, realistic portrayals of sexuality. Positive representation. Seek out media that offers positive and respectful representations of sexuality, diversity, and consent. Educational content. Opt for educational content that provides accurate information about sex and relationships, helping to build a more informed perspective. Promoting healthy portrayals. Realistic expectations. Choose media that presents realistic expectations about body image, sexual performance, and relationships. Diverse bodies. Look for content that showcases diverse body types and challenges unrealistic beauty standards. Authentic relationships. Favor media that portrays authentic, respectful, and consensual relationships over those that glamorize unhealthy dynamics. Balanced consumption. Balance your media consumption by including content that fosters a positive and inclusive view of sexuality. Variety of sources. Diversify your media sources to gain a broader perspective and avoid echo chambers that reinforce narrow views. Critical balance. While enjoying entertainment, complement it with content that encourages critical thinking and self-reflection. Creating boundaries. Setting limits. Establish personal boundaries regarding the type and amount of media consumed to avoid negative influences. Content warnings. Pay attention to content warnings and avoid media that you find distressing or triggering. Screen time management. Limit screen time to ensure a healthy balance between media consumption and other activities. Mindful engagement. Engage with media mindfully, being aware of its potential impact on your perceptions and behaviors. Active viewing. Watch media with an analytical mindset, questioning and discussing its content rather than passively consuming it. Reflective practice. After consuming media, take time to reflect on how it has affected you and discuss any concerns with trusted friends or partners. Conclusion. Developing media literacy and making selective viewing choices are crucial for promoting healthier, more realistic attitudes towards sexuality. By understanding the intent and context of media content, and by choosing media that aligns with personal values and promotes positive representations, individuals can navigate the complex landscape of sexual media more effectively. Creating boundaries and engaging mindfully with media can help maintain a balanced perspective and foster healthier relationships. Self-awareness and reflection. Navigating personal values and body positivity. Introduction. Self-awareness and reflection are foundational components of personal growth and healthy relationships. They involve a conscious effort to understand one's own values, beliefs, and attitudes, especially concerning sensitive areas like sexuality and body image. This chapter explores how individuals can develop self-awareness and engage in reflective practices that affirm personal values and promote body positivity, independent of often misleading media influences. Self-awareness and reflection. Personal values. Reflecting on personal values and beliefs about sex. Identification. Begin by identifying your current beliefs and values about sexuality. Reflect on how these have been shaped by your upbringing, cultural background, personal experiences, and media exposure. Separation from media influences. Critically assess the extent to which media has influenced your views on sex. Distinguish between what you genuinely believe and what may have been adopted from external sources. Reevaluation. Consider whether these beliefs align with your personal ethics, comfort levels, and the reality of your experiences. Be open to reevaluating beliefs that no longer serve your best interests or that contribute to feelings of guilt, shame, or inadequacy. Alignment with actions. Ensure that your sexual behaviors and decisions align with your personal values, not just societal expectations or media portrayals. This alignment promotes authenticity and integrity in personal and intimate relationships. Body positivity. Cultivating a positive body image. Recognition of unrealistic media representations. Acknowledge that media often portrays body types and sexual attractiveness in a way that is not representative of the general population. Recognize the use of editing, filters, and selective presentation in creating these idealized images. Self-acceptance. Work towards accepting and loving your body as it is. Focus on its strengths and capabilities rather than any perceived flaws. Celebrate the diversity of human bodies, recognizing that there is no single ideal body type. Challenging negative self-talk. Pay attention to and actively challenge negative thoughts about your body. Replace critical or comparative thoughts with affirmations that reinforce self-worth and body respect. Affirmations and positive reinforcement. Use positive affirmations that reinforce your worth and beauty. For example, affirmations like, "My body is capable and strong," or, "I respect my body and reject unrealistic standards," can be powerful. Supportive communities. Engage with or create communities that support body positivity and diversity. Surround yourself with messages and people who uplift rather than judge or criticize. Integrative practices for reflection. Journaling. Utilize journaling to explore and clarify your thoughts about personal values and body image. Writing can help you track changes in your attitudes over time and reflect on influences that might have shaped your beliefs. Mindfulness and meditation. Incorporate mindfulness practices that focus on body acceptance and living according to your values. Meditation can be a tool to ground your thoughts and reduce the impact of negative media influences. Educational resources. Educate yourself about the diversity of human sexuality and body types through books, documentaries, and workshops that promote a realistic and inclusive perspective. Conclusion: self-awareness and reflection are critical for developing a healthy relationship with one's sexuality and body image. By actively reflecting on personal values and cultivating body positivity, individuals can build a more secure and accepting self-identity. These practices help to mitigate the negative influences of unrealistic media portrayals and support living a life that is authentic and fulfilling. Through ongoing reflection and commitment to these principles, individuals can foster a healthier personal and sexual self-image that is resilient against external pressures and distortions. Effective communication. Addressing media influences in relationships. Introduction: effective communication is a cornerstone of healthy relationships, particularly when addressing how external factors such as media influence perceptions and expectations about sex. Media often presents an idealized, sometimes unrealistic picture of sexual interaction, which can shape individual expectations and potentially create discrepancies in relationships. This chapter explores strategies for discussing these influences with your partner, recalibrating expectations, and seeking professional guidance if necessary. Effective communication. Addressing media influences. Discussing media influences. Open dialogue. Initiate open conversations with your partner about how media, movies, television shows, pornography, and advertising might influence your own and your partner's expectations about sex. Identify specific influences. Together, identify specific media content that has influenced your perceptions and discuss its impact on your expectations. For instance, if certain films or pornography have shaped what you find arousing or desirable, share these insights with your partner. Express feelings and perceptions. Encourage each other to express how these influences might have created certain hopes or insecurities about sexual encounters. Being open about these feelings can help both partners understand each other's perspective and foster empathy. Address discrepancies between fantasy and reality. Clearly differentiate between what is often shown in media and the realities of your own sexual experiences. Debunk myths. Work together to debunk myths or misconceptions that media may have propagated about sex, such as the necessity for perfection, endurance, or specific body types. Validate real experiences. Validate each other's experiences and feelings about sex, acknowledging that real sexual encounters can include awkwardness, imperfections, and a range of emotions. Recalibrating expectations. Focus on mutual satisfaction. Shift the focus from living up to media-driven images or performances to achieving mutual satisfaction and comfort in your sexual relationship. Explore personal desires. Discuss and explore what genuinely satisfies each of you. Acknowledge that these desires might differ from popular media portrayals and emphasize personal satisfaction over performative actions. Set realistic goals. Set achievable and realistic sexual goals based on your mutual comfort and desires, rather than striving to emulate unrealistic standards or scenarios. Adapt and evolve. Recognize that sexual preferences and comfort levels can evolve. Regularly check in with each other to adapt your expectations and experiences accordingly. Continual learning. Stay open to learning from each other and adjusting your sexual relationship as you grow together. This includes trying new things that are mutually agreeable and stopping what doesn't work for both. Seeking guidance. Professional help. If media influences have significantly impacted your relationship, particularly if they contribute to stress, dissatisfaction, or conflict, consider seeking guidance from a therapist or counselor. Sex therapy. A sex therapist can provide professional advice and strategies to address issues arising from unrealistic media expectations about sex. They can help you understand sexual health and satisfaction more deeply. Couples counseling. Couples counseling can be beneficial in improving communication about sexual issues and other aspects of your relationship. A counselor can facilitate discussions that might be difficult to handle alone, helping both partners express their needs and concerns in a supportive environment. Educational workshops and resources. Participate in workshops or utilize resources that focus on sexual education and communication skills. These can provide both partners with knowledge and tools to enhance their understanding and enjoyment of their sexual relationship. Conclusion: effective communication about the influence of media on sexual expectations is crucial for maintaining a healthy and realistic sexual relationship. By openly discussing these influences, recalibrating expectations to focus on mutual satisfaction, and seeking professional guidance when needed, couples can enhance their intimacy and navigate media impacts constructively. This approach helps build a stronger, more understanding connection between partners, grounded in the realities of their shared experiences rather than the idealizations of external media.